So my name is Grace Kistner. I've been in healthcare and promotion since 2007. I've been a nurse since 2013. I have a background as a business degree, and then I went into nursing. I've been educated across 4 continents with privilege. I've worked and volunteered in a clinical capacity in about 12 different countries. I've had a lot of experience knowing what works well and what doesn't, and I'm very passionate about grassroots advocacy and developing nursing leadership.
That's great. So, can you tell me about what pushed you, made you decide to go into nursing in the first place?
Yeah, when I was finishing my business degree, I didn't really have a passion or calling, and it was going to be very difficult for me financially to graduate into that profession. But in the meantime, I was working at a pharmacy, actually, and it was a very small pharmacy that was independent, and they worked very closely with the members in the community, the patients, and also the medical profession. So I got to work alongside, shoulder to shoulder, with pharmacy students. I also got to talk to doctors on the phone, taking orders and providing information to them about the patients. And then I also was able to work with a nurse who was a visiting nurse. She provided vaccines, but she also did really innovative things, interesting things that you wouldn't think about a nurse doing. And so I got to see the breadth of what nursing does and how close they are to the patients. That was different from what a doctor or a pharmacist does. So I graduated and I went right into nursing.
Oh, wow. So, what did that brought to you? That business background, that bachelor degree in business.
It made me think differently, and I did not realize that at first. I thought differently than other nurses, and I thought at a systems level earlier than I realized it was a systems level. So when nurses feel pain and frustration at the bedside, we do workarounds to make sure that we can do our job, right? But I understood why some things happened from how a hospital has to operate on a business level, but it still wasn't correlating with what you need to do as nurses to take care of the patient. So I saw the difference, I saw the frustrations, but I knew that approaching it had to be different than just complaining about the gloves being on the other side of the room or not.
After you got into nursing, what was challenging?
I think the most challenging part was around those workarounds. So we call those workarounds in nursing, but really we should call them innovations because we innovate every day to change patient care for the better. But because I worked all around the country as a traveling nurse for 8 out of the 10 years that I was in direct care, I saw more than one way to do things, to do it right and to do it wrong, and that there's not only one way to do things. But because I wasn't staying in one hospital all the time, I wasn't climbing what we have in the US as a clinical ladder, and I wasn't becoming a nursing charge nurse or nursing manager or nursing executive in one facility. So I didn't have any pathway to influence, to actually have authority with what I wanted to influence for change. I was kind of dismissed as just a warm body, another nurse at the bedside. And I didn't want to be in management because I saw that even nurses at the top level in a hospital, it can still only influence one thing in a hospital. They're not still influencing the whole system, and that's what needed to change.
So, what have you done?
So I struggled to get recognition from the leadership experience that I had. I've completely taken care of leading clinic trips around 12 different countries around the world. That not was only the medical and nursing providing care that we did, but I started the trips. I got the people together. I taught them cultural humility before we left. I talked to them about travel. I managed the budget. I led 15 to 40 people around the world, sometimes all the way up to executive levels. That's leadership that's not just soft skills, but it didn't come with a title, it didn't come with pay, but there's a lot of experience that I got there that other nurses hadn't had, especially they've only worked in one unit for their whole career. So I had to find really creative ways to get recognition for that leadership. And in nursing, we like to have this alphabet soup behind our name, to say that we know what we know.
Yeah.
But I knew that to get more letters behind my name in nursing was still going to be very limiting. So I got letters behind my name in other certificates in other sectors. And I knew that I had to do that because I had a business degree. So I got business credentials, I got nursing credentials, I got program management credentials, I got development and global health credentials. so that I could show how well-rounded my experience and acumen was and be able to speak to different audiences to tell them about the skills I had.
How have you been exposed to the global health, to global health?
So, because I was fortunate enough to travel and be educated across 4 continents, I studied abroad for business in the EU when I was in my business school, and I did my public health rotation in nursing school in Brazil. And I knew that I was interested in global travel and international things, exposure to other cultures, but this was a way for me to marry the 2 degrees and have international experience. After I got my experience after the bedside, after school, I continued to lead those clinic trips. I did about 3 or 4 a year, every year, until I was pulled out of West Africa on March 12th of 2020. And when I came home, it was all COVID for 4 years straight. And that was when I knew that once I could financially pay off my student loans and step away from the bedside, that I would go into global health as a profession and step away from direct care, even though I loved it.
Okay. And can you explain the program you are in right now?
Yeah, absolutely. So a lot of people told me to go for an advanced degree, and because I already had 2 degrees, and because it was so expensive, and it's really a problem in the U.S., and because there wasn't a program that spoke to me, I did things differently, non-traditionally. None of these advanced degree programs seemed like they would be really what I wanted, and they were too expensive. So finally, when I heard about the program at the University of Global Health Equity that was built by Partners in Health in collaboration with the Ministry of Health in Rwanda, I knew that that program spoke to me and was right for me, and that was the exposure that I wanted and the education that I wanted. And it was completely founded, the school is founded on the principles of Partners in Health, which talks about social medicine and accompaniment.
Okay, good. And what do you expect to get out of that program? What do you expect from it?
Yeah, so I was finding the other non-traditional grassroots ways of getting into leadership positions, not inside of clinical walls, while also going through this program. So things that I've done on my own are I co-facilitate the Nurse Policy Entrepreneur Cafe, and that is a free, global, online, once-a-month convening of nurses that are opening up group mentorship to talk to each other about how you approach policy and how that changes your identity by developing knowledge, skills, ability, and confidence to become a full partner in healthcare reform with all other professions. Another thing that I've done in the meantime is I'm now on the board of directors for SONCIEL, the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, and I chair their UN committee, and I provide opportunities for nurses to immerse in the UN level. So all the way from students up to retirees, we go to the United Nations, we take tours, we talk about how the UN Charter overlaps with our Code of Ethics, and we get private briefings from UN agency representatives, and then we talk about how we can actually advocate from a civil society and grassroots approach and really elevate 30 million nurses around the world to advocate to center health in all policy. And we also introduce an innovation sprint that's AI driven, so it's really innovative. All the while I've been doing that, I've actually been growing in the program, and now I'm finishing with my dissertation, and that's focused on what's really true and central to my heart, nursing leadership development, but at the national level. So I'm interviewing government chief nursing and midwifery officers and asking about their experience coming up into that role, and now that they're in it, what it's really like, because we don't have that in the literature right now.
Exactly why I started this. So that's what keeps you motivated?
I think that there's moments like this when I'm in rooms with amazing nurses, global nursing leaders, and nursing educators, advocators, and students who really see that this is a problem, but one that we can and should address. And I see so many nurses that I talk to on an individual level that think we've been discussing this for so long. There's been so much evidence out there for decades now about the power and the value of our care and how we need to become leaders at higher levels, but we haven't yet crossed that bridge to actually taking action. And so I came into the profession at the moment where there was just enough data to start getting out there, but not yet that transition from advocacy to action. And that's what I want to see forward, and I see hope for that.
Nice. And what is one thing that you have learned in your journey that now guides your decisions and also your overall well-being?
That's really important. I've noticed that I think some of the reason why this hasn't happened, that transition from advocacy to action, hasn't happened as much because it's lonely. There's really not a lot of nurses who have that extra motivation to get across that hump and keep going despite how difficult it can be. And I think that's naturally built into the way that we've been nursing so far, the way our profession is. We are overburdened, we are overworked, we're doing so much. We work these long hours, sometimes unpaid, underpaid for sure, and then we go home and we're the caretakers of our family. And we don't take care of ourselves. But where I've seen this succeed and where I've had the most hope is when I find nurses that are like-minded, that just need that other person to find that community and belonging, to realize it is worth going forward and pursuing, and that it can make change.
And do you engage in any art activities or meditative activities? What do you do to take care of yourself?
I'm an ICU nurse.
Yeah.
I might be creative, but I don't feel creative. I'm very structured. But I do know that there are a lot of nurses out there who are creative.
You get healthcare leaders to share their stories. I think that's an art.
Yeah,
A form
I would
of art.
agree.
Yeah.
That's a good point. And
Yeah.
one way that I've been trained to do that is through programs like the Climate and Health Organizing Fellowship. And that's built from a Harvard program strictly to help healthcare professions, doctors, nurses, and the like, to understand how to tell our stories of our jobs, what we do day in and day out, and communicate that value while also communicating truth and science to policymakers, to the public, and really understanding that our stories have value, even though we don't feel like we're the most expert on every little thing, but we feel it deeply and we see it deeply. And those frontline insights are really what can drive change if we can explain it and communicate it well for others to understand the pain points we see every day.